Welcome to today's lecture. My name is Dr. Anne Waweru from Department of Animal Health and Production, School of Pure and Applied Sciences. The subject for today is epidemiology, BAH4208, and the topic for today is investigating a disease outbreak. The outline of the presentation have the objectives of this presentation, an introductory part, and the steps that are involved in investigating a disease outbreak. So objectives, number one is to define the terms outbreak, epidemic, and pandemic. Number two, to understand the rationale for investigating an outbreak and to describe the steps of a disease outbreak investigation. Introduction. The purpose of this presentation is to talk about the steps taken in investigating a disease outbreak, and the target audience is the epidemiology students in animal health and production, or any other person who may be interested in knowing how to conduct a disease investigation, a disease outbreak investigation. And for an outbreak to occur, it does not necessarily have to be an infectious disease, and we have recorded outbreaks that have been foodborne. For example, E. coli, Salmonella, Vibrio, Listeria, or any other disease outbreak caused by any other bacteria. All right, to the body of the presentation today. The terms epidemic, outbreak, cluster, and pandemic. And an epidemic is the occurrence of more cases of disease than expected in a given area. Normally, in any setting, there is the number of disease numbers that are expected. If this number goes beyond what is expected, then that becomes an epidemic. While an outbreak is an epidemic that is limited to a localized increase in the incidence of the disease. And an incidence of the disease is new cases. Yeah, as opposed to epidemic, for outbreak we focus on the incidences of disease. For cluster, it's an aggregation of cases in a given area, while a pandemic is a worldwide epidemic. For example, we are dealing with one, COVID-19 or coronavirus disease. And unlike the others, pandemic is covering many countries or even continents. Currently, the coronavirus disease is in almost every country in the world. Why then do we need to investigate a disease outbreak? Is to prevent and control the disease, and that is the most important. While there are other reasons, like maybe a disease is a public health concern, we want to do a research on a certain disease, it is probably of a political interest, you know, it is necessary for training, or you just want to learn more about the disease. Purpose of investigating a disease outbreak. The main aim is to stop the outbreak, and to do this you need to ensure public health. It ensures that the public is in good health, to prevent the spread of the disease, and it requires identification of the agent. Is it a virus? Is it a bacteria? Is it a fungi? It identifies the reservoirs, the sources, and the modes of transmission. It also helps to determine who is at risk. Is it the old people? Is it the pregnant? Is it those who are maybe suffering from underlying conditions, etc. It also requires identifying the exposure or risk factors that increase the risk of the disease. And apart from stopping the outbreak, we also want to prevent future outbreaks and also improve surveillance and outbreak detection. Now on to the steps involved in outbreak investigation. There are 10 of them. Normally we follow each step one after the other, but sometimes you may have to, come from maybe step number 1, go to step number 5, go back to step number 2, like that. So in a nutshell, those steps that I have shown in the previous slide are in a conceptual order. However, in practice, several steps may be done at different times. Yeah? For example, you can implement some control measures before you even start communicating. Like, for example, in the COVID-19, we were asked to, keep social distance, sanitize our hands, keep washing our hands all the time, avoid contact with people who have traveled. So you can do that while other steps of investigation are still ongoing. So step number 1 is to establish existence of an outbreak, and this is done by checking the numbers. Yeah, as we agreed earlier, for a disease outbreak, the numbers are usually in excess of what is expected. So you need to know what is the expected number. For example, for COVID-19, we are supposed to have 0 numbers. So if you have one coronavirus disease case, then it will be considered an outbreak. So surveillance data in this case becomes very important because it is what is going to guide you on what is the expected number and whether the numbers have gone beyond what is expected. And at this juncture, we need to be aware of artifactual causes of increase or decrease of reported cases. If there is a change in the reporting practice, a change in the case definition, or a new technique for diagnosis has come up, it may show like the number of cases has increased, while in real sense, there is no change, yeah, and we need to keep that in mind. Step number 2 is to verify the outbreak, and the verification is by confirming clinical diagnosis, and this is done in the lab, yeah, and not every case is supposed to be tested. Just because you're showing signs that may show like you are having that disease, does not mean that you have to be tested. So you need also to interview cases, and cases in this case, we mean the people who are showing the disease clinical signs. You also need to interview the contacts. Those are the people who have come into contact with someone who has either tested positive or is suspected to have the disease. Step number 3, you need to define a case. I've talked previously about a case definition, and a case definition is a set of standard criteria for deciding whether or not an individual fits to be a case in a particular outbreak. So the outbreak should be simple, yeah. It should include almost all the cases. Yeah, the case definition should be simple enough, but still loaded enough to capture all cases that may be present in a particular area. For example, we can have different degrees of case definition. Like, for example, you can have a suspected case, a probable case, or a confirmed case, depending on whether or not the case has been, has undergone some lab testing to show whether they are positive for a disease or not. And for a case, again, to be defined, it requires clinical information. We are going to see more of this in subsequent slides. And you need to describe the epidemiology. In this case, we describe the time when the disease occurred, the place, and the person or the animal who is involved. You need to tell the age, the race, the sex, that is the gender, and many other things, just to describe the case so that you may have an idea of what could be ailing them. So even if one is not a clinician, it would be very important to review medical records of this case. If it is possible, you need to see this case, see how they are presenting, so that when you see other cases, you may have an idea of how the disease is showing. Now, different case definitions have different strengths. So we have sensitive versus specific case definitions. And for often, to have a looser case definition is more helpful in case finding. And for loose case definitions, you will have many clinical signs. For example, in the case of COVID-19 disease, you may want to include fever, coughing, difficulty in breathing, a range of many clinical signs or many exposures to make sure that many cases have been captured. And as a looser case definition is more important in case finding as compared to a tight case definition. And a sensitive case definition means that the case definition has the ability to detect all cases, while a specific case definition means that there is ability to exclude as many negatives as possible. So it's important to know what is your aim. Do you want to capture as many positives as possible, or do you want to exclude as many negatives as possible? For an example of COVID-19 disease case definition, as we mentioned earlier, the case definitions are divided into suspected, probable, and confirmed. According to WHO, a suspected case can be either of these. I will just pick one for purposes of time. A patient with acute respiratory illness, for example, fever, and at least one sign or symptom of respiratory disease such as cough, shortness of breath, and no other etiology that fully explain the clinical presentation, and a history of travel or residence in a country reporting local transmission of COVID-19 disease during 14 days prior to symptoms onset. And there are many, I've seen different case definitions for COVID-19 depending on which site you open, but for the WHO, that is one of the case definition for a suspected case. We have case definition for probable and confirmed. A probable case for COVID-19, according to WHO, is a suspected case whom testing for COVID-19 is inconclusive. And this just means that the laboratory is not sure. Maybe the results were not conclusive. And a confirmed case is a person with a laboratory confirmation of the COVID-19 infection. Step number 4 is identification of additional cases, and this is again a very important step because this is where you catch as many cases as is possible. So regardless of the disease you're investigating, you should collect as much information as possible. You can you start with the identification information of the person who is suffering, the name, the address, the telephone number, where are they coming from. The demographics, the age, the sex, the race, occupation, and all that. And maybe even hobbies, because there are people who have hobbies of traveling, and those will be at a higher risk for contacting a disease such as COVID-19. You also capture clinical information, and this would allow you to verify the case definition has been met. We have already talked about the case definition. Include risk factor information. Yeah, and I've given an example here of COVID-19. You would look at history of travel or contact with a person who has recently traveled or has tested for COVID-19. Still, in additional cases, you need to do what you call line listing. And traditionally, we use a form, where you write the name of the patient, where they are coming from, and all that. But afterwards, you transfer this information to a table that is called line listing. So it is a table with columns and rows, and each column presents a variable, maybe age, sex, occupation, and such things, while the rows will be the number of the case. Yeah, so case number 1, number 2, number 3, like that. I have an example I will flash in a while. So this simple format allows investigators to scan key information on every case that is and update it easily. And even if we are in the age of computerization, many epidemiologists still prefer to use, hard copies, because it is very easy to carry it with you. You keep checking, and maybe you may find something that you missed initially. In epidemiology, line listing is one of the basic methods used to collect data, display data, analyze, and give a lot of information on outbreak information. It is essentially a table that displays rows and columns, as I have earlier alluded. So this is an example of a line listing. So you have the columns, which will show the variables. For this case, probably there was clinical signs of diarrhea and vomiting. So the number 1 will be on these columns. The rows rather, will be the case number 1, the date of onset of the symptoms. Does he have diarrhea? Yes. Does he have vomiting? Yes. Is the fever above 37? Maybe the temperature was not taken. And then you fill in as the cases come. So you can have number 1 to number 7,000, and if you have used an Excel sheet, then you would be able to have a clear picture of how line listing can be done. Now for COVID-19, we can have as many variables as is possible. Yeah, the country, the date of onset of the disease, the country, the age, the sex, the trimester, because apparently the disease is affecting the pregnant more adversely as compared to people who are not. And then you will fit this in the line listing, and then you will be ticking yes or no for each particular patient. Step number 5 is perform descriptive epidemiology, and in previous lectures we have talked a lot about descriptive epidemiology, and this is where you describe the who is affected, where is it occurring, when did it start, what is it, is it a viral, is it a parasitic, is it a foodborne disease, and how many have been affected. But we summarize it as PPT, which is the person, place, and time, and you describe each one of it. Now, for example, if you start by person, you describe the personal characteristics, the age, the gender, the race, etc. Exposure, does he smoke, is he on medication, leisure activities, occupation, etc. For place, where did it occur, the geographical distribution, is it near a water supply? Is it because of a food that was eaten? Or did this person travel to a country that is known to have that disease, etc. Again, describing the place may help in identifying the vehicle or the mode of transmission of a particular disease. And maps are extremely important, including spot maps. Currently, every time you open the media, you will be seeing different maps showing where the COVID-19 is occurring, and depending on how much color is on that particular map, you will know that the cases are so many as compared to others. The time, of course, is very important, especially the onset of the particular disease. So this characterizes the cases by plotting a graph, or what is called an epidemic curve. I'm going to show you a diagram of that, and it is a graph of number of cases on the y-axis and the time of onset of illness on the x-axis. And an epidemic curve is important because it gives a lot of information. It shows the date of the illness for the first case. It shows how the disease is spreading. It shows when the outbreak peaked. Yeah, it shows the pattern of spread, it shows outliers and many others as outlined in that slide. An example of an epidemic curve is this that was for Ebola. So we know that this first case, you know, it started on the 9th of January maybe. I don't remember which year this was. Yeah, and it will show you when the disease peaked. It will show you outliers, you know, these ones here, where you cannot really relate them to any other case that has occurred. I have another example for the COVID-19 outbreak, and this is a distribution of the cases worldwide as of 18th March. So again, it will show you the spread of the disease, when it peaked, when it went down, you know, and of course the dates of onset of the disease. So step number 6 is to develop and test hypotheses. Now, we have done the descriptive epidemiology. We have described the person, the place, the time, the how many, and all that. So in this step, you go a step further. You rely on the data you have collected on the descriptive epidemiology to carry out analytical epidemiology. And as we have already discussed in previous classes, analytical epidemiology answers the question why and how. All right, and to answer those questions, you are required to carry out analytical epidemiological studies, for example, cohort studies and case control studies. And we have already covered that in class, so it shouldn't be hard for you to relate. Again, to develop and test the hypothesis, you need to identify the route of exposure, and the hypothesis should be testable. Yeah, and of course it relies on the descriptive epidemiology, as we have earlier seen. So to generate the hypothesis, you of course use the descriptive epidemiology, and to test it, you sort out the characteristics that are common among the non-cases and the cases. And if there's no difference, if there's no difference between the cases and the non-cases, you know, a statistical significant difference, then you come up with a new hypothesis, and that's the next step. You reconsider the hypothesis. You align the hypothesis to clinical and laboratory and epidemiological facts, and if exposure history for ill, that is the case, versus the non-ill, that is maybe the controls, then you require a new hypothesis. Number 8, you perform additional studies. Of course, when you come up with a new hypothesis, you carry out different epidemiological studies to either accept or refuse the hypothesis. Step number 9, you implement control measures. And the main reason for outbreak investigation is to prevent and control the disease. So prevent exposure, prevent infection, prevent the disease, and prevent death. For example, keep social distance for COVID-19 disease. Wash your hands, sanitize. Yeah, stay at home, quarantine yourself, isolate yourself, and if you do that, your at least chances of getting the disease will be minimal. So underlying purpose of all epidemic investigation is to control the spread of the disease. I think by now that should have sunk in, to prevent morbidity, that is the number of cases, and to prevent mortality, that is the deaths. So quarantine, isolation of individuals to reduce spread, removing possible vehicles, and vehicles in this case include, if it's something like food or water that could be spreading the disease, and for where possible, you can do vaccination. Step number 10, and the last step in outbreak investigation, is communicating the findings. I'm sure by now you have seen the CS of health, carrying out press briefings from time to time. So this should be done as a step in outbreak investigation, and it should be done by authorized personnel. For example, the outbreak investigation staff, public health personnel, government officials, healthcare providers, media. And for those who are allowed to, there are those people who are at home, maybe may not be able to listen, maybe not be able to, to understand maybe English. You can interpret for them, and you do it ethically. Do not give them lies, do it in the right way. Finally, emergency risk communication, and it should have principles. Yeah, when you're communicating information about a disease outbreak, do not make people panic. Yeah, do not emphasize on the process in place. Tell us that you're trying to contact the people who have come into contact with the possible cases. Don't over reassure. Don't give false information. If you follow all this, you will be good to go for the communication of the risk. Challenges that are there in investigation, maybe little data, small numbers, publicity. People are scared of being interviewed. Others are reluctant to participate in outbreak investigation and all that. So if you want to read more on outbreak investigation, you can read those two books and CDC website and the WHO website. So thank you very much for listening. That's the end of our lecture today, and please stay safe.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.